Welcome to the Johns Hopkins Women's Health Podcast, A Woman's Journey, Insights That Matter. I'm Kelly Gear-Ripken, and I invite you to listen to Johns Hopkins specialists discuss the latest topics in women's health. Now here's your host, Lillie Shockney.
Hi, this is Lillie Shockney from A Woman's Journey at Johns Hopkins, and this is our podcast, Insights That Matter. Today, I am joined by epidemiologist and Senior Director of Infection Prevention for the Johns Hopkins Health System, Dr. Lisa Maragakis. Today, we're going to be talking about COVID-19 and its variants. Thank you, Dr. Maragakis, for joining me.
Thank you for having me.
So 2020 was a difficult year for everyone, to say the least. COVID-19 has certainly upended our lives, not just here in the United States, but around the world. The good news is that finally we are in the process of rolling out highly effective COVID-19 vaccines. And the good news is that the data show that these vaccines are effective against these variants. The CDC announced that those who have been vaccinated no longer need to wear masks, but confusion continues to exist about the different variants that have emerged, and if the current vaccines offer the same level of protection against the known variants. So first, please explain what a variant is and the various variants that exist today, and clarify the differences between them.
Of course, happy to address this, Lillie. This is an issue that arises when viruses change and mutations accumulate. And in some cases, those mutations are beneficial to the virus. So when we're looking at the SARS-CoV-2 virus that causes COVID-19, surveillance was conducted for many months at the beginning of the pandemic, and we really didn't see very many mutations emerging. Unfortunately, after approximately a year of the pandemic, we started seeing variants of interest and variants of concern, which are terms that the World Health Organization uses and the Centers for Disease Control and Prevention use to draw our attention to some of the versions, if you will, or variants of the virus that have accumulated some of these beneficial mutations. So a variant of concern is defined as one that has demonstrated that it has a degree of impact on the global public health. In some cases, they're more transmissible viruses. In some cases, they're more virulent or severe in their clinical presentation. And sometimes these mutations and variants lead to less effective public health measures like our vaccines or our diagnostics or our therapeutics. So any of those things cause it to be a variant of concern. And just below that would be variants of interest that have started along that path, and we're watching them very closely. And there are a number of these, as I'm sure everyone has seen reported, initially named after the geographic regions in which they originated and where they were first identified. But what we know about the SARS-CoV-2 virus is that any of the variants can spread worldwide very quickly, especially if they have beneficial mutations. And that is what we have seen. And so recently, the WHO renamed the various variants using Greek letters from the alphabet and trying to get away from those labels that tie individual variants to geographic regions or certain countries.
I think that's very smart that they are looking at calling it something different other than where it originated geographically, because we certainly don't want to have what we have been seeing across the country of, I'm going to call it bullying to be polite. It's very unfair to individuals whose origin is that country. Now, lately, very recently, we've been hearing about a new variant that's happening in India, and it's been named the Delta, as I'm sure you know. Can you tell us a bit more about that particular one? I've been reading and watching the news that there's a very low volume of individuals in India who have been vaccinated. The last information that I had seen on TV was around 1%. Which is almost like saying no percent. And an extraordinarily large volume of individuals have been diagnosed, and so many have died. I don't know if we'll ever be able to really have the actual accurate statistics for that country. But now they're dealing with Delta. And of course, that means that Delta can travel to other places, including here in the United States. So can you educate us on that particular variant?
The situation in India is truly tragic, and the world community is rushing in to really try to support the country in their time of need. And we've seen this kind of event in the pandemic response where a certain geographic region may avoid having the most severe outbreaks and then be very hard hit by the pandemic. And that has been true in India of late. And it is a true humanitarian crisis. The Delta variant that was first identified in India, and there are other variants there as well, has, yes, also been identified in other countries. And we know that this is a variant of concern that we will have to watch and be cautious throughout the world to understand more about this variant, its clinical manifestations, and the effectiveness of our therapeutics and vaccines. What essentially happens to any of these variants, and the Delta is an example of that, is an accumulation of mutations that are beneficial to the virus. Most of these mutations that seem to be emerging and becoming dominant among the circulating strains of the virus are in the spike protein. And that spike protein is on the surface of the virus. It is composed of two subunits that allow the virus to bind to a receptor on our cells called ACE2. And that is how the virus gains entry into our cells. Many of the mutations that we're seeing emerge in the variants are in this spike protein itself. And we see over time in viruses that mutate in this way that the binding to the receptor is tighter, that it allows the virus to be more efficient at entering the cell. And this is likely the mechanism underlying transmissibility so that you get more viral load, a higher number of virons with some of these variants during infection. And in addition to being more transmissible, it can actually cause more severe disease and additional symptoms. We are now hearing reports that the Delta variant itself may be manifesting in hearing loss and in some cases gangrene. Of course, more clinical investigation needs to be conducted to understand how much of this is due to the direct effects of the virus and how much may be related to other clinical situations around the region in which it's spreading.
How is a variant discovered? Because we'll just hear on the news there's a new variant and it's been identified in thus and so population in the world.
It's so important that we pay attention to the mutations that are occurring in the virus and identify these variants. And the way we do this is by deliberate whole genome sequencing of samples of the virus. And so we do need to make this a more robust program of surveillance worldwide. The variants that have been identified are due to this type of surveillance and study of the genetic material of viruses that are recovered from infected individuals so that we can know what mutations are accumulating, what viruses and variants are emerging. And we know that whole genome sequencing takes resources. It takes labs that are able to conduct that surveillance. And if you're not looking, you won't identify the variants.
That makes perfect sense. And I would assume that until we truly do have enough individuals vaccinated around the world, not just here in the US, we should anticipate that there's going to be more variants.
Absolutely. The very best thing that we can do to prevent the emergence of more variants and more virulence in this virus is to stop viral transmission. And the very best way we can do that is having vaccination for as many people worldwide as possible. These pockets of, well, in some cases, entire countries of rampant viral transmission, where we see many, many cases on a daily basis, every single one of those is an additional opportunity for the virus to continue to evolve and mutate and for variants to emerge.
So herd immunity is a term that I think just about everyone has heard about, but may not really understand what is herd immunity and why is it important?
Herd immunity basically refers to the concept of having protection, immune protection amongst enough members of a population so that the virus has difficulty transmitting from one person to the next. If you imagine one infected individual surrounded by protected individuals, either because they've already had the disease or because they have been vaccinated, that infected individual won't be able to really transmit the virus to as many people as if all the other people were susceptible. And that's where the vaccination campaigns in each country around the world are so important. If we could achieve 70, 75% or even greater vaccination of the population, then it becomes very difficult for that virus to continue to spread unabated.
I've been hearing some individuals actually say to me, I don't need the vaccine because I've already had the COVID-19 virus 8 months ago. And I'll say, oh, were you tested also to confirm? No, but I could tell by the way I felt that I had the virus. And of course, I launched into a medical discussion with that person explaining that you might think that you had the virus. You don't really know if you've had the virus. And even if you did, and we could confirm that you did with antibodies, you still should be getting vaccinated.
It's so true. And it's wonderful that you're having those conversations. We are finding that it's important for that information to come from trusted individuals, and people absorb it better and believe it more when they hear it from a trusted source close to them. There's several things, as you pointed out, that are wrong with that line of thinking. One of them is that if you haven't been tested to confirm the diagnosis, it's possible that you didn't even have SARS-CoV-2 or COVID-19. However, even for people who had a test and know that they did have the disease, we don't yet know about the duration of immunity. What we know from laboratory studies is that the vaccination gives you a much stronger, more robust, and longer lasting immune response than natural infection. That's not always true of different types of infections, but it seems to be true for this virus. So the recommendation right now is that everyone be vaccinated, even if you've previously had the infection.
How do we convince individuals who are truly frightened that the vaccine is going to cause some other complication within their body, not necessarily the day they get it or a week later or even 6 months later? But I've been talking to younger people in their 20s, 30s, early 40s, but particularly 20s and 30s, who are truly petrified to get a vaccine. Doesn't matter which one it is. They're like, oh, no, that's going to cause me to be infertile and we still plan to have a family. Or I've heard it does this, I've heard it does that, or because it's brand new, nobody knows what it could do 5 years from now to my body. And it's a tough argument because I can't say, well, we've known about this for 22 years, like the flu virus, right? Because we haven't. But I still defend my position on the importance of getting vaccinated. And I let people know I have been vaccinated. I'm thankful to be vaccinated, but I've not been able to dissuade individuals, particularly in this age group, and they're not willing to let their teenage children be vaccinated either. It's like this big barrier. I'm slamming my head up against this big barrier. If it only affected that individual, I would say, well, if you're a risk taker, and it sounds like you are, off you go alone. But it doesn't just affect them. That's where I draw a line in the sand and say, please listen to me. I'm a medical professional. Please hear what I am saying. So I'm sure that you've had even more conversations that I've had. I have at least one a day with somebody. But in your line of work at Johns Hopkins, obviously, I'm sure you were plagued by this, I'm just going to call it misinformation that's been created out of fear. And fear is a powerful weapon that people will use to not do something that is beneficial for them.
It's incredibly frustrating to see, and you've described it so well, Lillie, that we have this amazing, miraculous solution to the pandemic and protection from not just one, but multiple vaccines that are safe and highly effective and were developed and tested and proven to be safe and effective in record time. So that to me is truly miraculous and a gift that we have been given. And yet, as you say, there's so much misinformation out there and very serious allegations against these vaccines. People have concerns, and there are a variety of kinds of hesitancy. And as you described, these conversations really have to address the core concern that an individual has to try to dispel some of this misinformation. And I think you've touched on such an important point, and that is that vaccination and infection prevention during a pandemic response is really a community activity. It is a group activity. And this is a time for all of us to pull together, work together to stop this viral threat. And individuals, of course, have to make their own individual health decisions, including about vaccination. But I'm not sure we have done enough to message the fact that our own choices, whether it be about vaccination or wearing masks or hosting large gatherings indoors, things like that, they affect, as you said, not just the individual, but the entire group and the community and ultimately the world. And that's why we have to care, not just about what's happening in our own region or our own country, but really look globally, because this is a worldwide threat. And it's going to take a community approach to making sure that, as the WHO has said, none of us is safe until we are all safe. That is one thing. I guess the other thing I would say that I do find is somewhat helpful talking with people is to frame the context of vaccination, reframe it when we talk about risk to include the risk of the virus itself, because I think some of this hesitancy and focus on the potential risks of a vaccine ignores the very real risk of the virus itself. And that gets back to this concept of community, because it's not just the risk to that individual who's making the decision, who may feel, well, I'm young, I'm healthy, I'm unlikely to have a severe form of the disease, but really asking that person to think about all of the other people with whom they come into contact each day that they might pass the virus to that would potentially have very severe consequences.
I also tell people, if you love yourself and you love your family, you will do this because it's the right thing to do. That does move some people, but others, it frankly does not. Do PCR tests detect the COVID variants?
So far, our PCR tests are detecting all of the variants. And so it's something to continue to watch and part of that surveillance for variants. But so far, our diagnostic tests are detecting the virus, and then further study through whole genome sequencing can tell us if it's a variant or not.
We now have more than adequate amounts of vaccine here in the United States, and we're sharing vaccine with other countries. Why should we care about other countries and trying to support them in getting vaccinated?
This gets back to the fact that this is a worldwide threat. We've seen how rapidly the original form of the virus spread around the world, and now we are witnessing how rapidly the variants are spreading around the world as well. We know that there's travel, there is global commerce, and a lot of opportunity for these viruses to jump from one place to another. Some of the countries that are island nations and have shut their borders have been able to be somewhat more successful in keeping it out, but even there, it is a struggle and takes a toll. So we need to look globally, and vaccination is our very best hope in providing protection and interrupting the transmission of the virus. I really applaud all efforts to provide vaccine to all the countries of the world. And it really does need to be a global initiative.
How is Johns Hopkins helping other countries? And can you also talk a little bit about how Hopkins is keeping the statistics?
Well, Johns Hopkins has been at the forefront of data from the beginning of the pandemic, and I'm very proud of my colleagues who put together the data dashboard that has been used worldwide to track the emergence of the virus and so many other epidemiologic statistics about deaths and vaccinations and recovery. And it's so important to have data. That is the information that we need in order to allocate resources and understand more about this virus and intervene to prevent further transmission. So the data analysis that Johns Hopkins has been able to provide has been truly remarkable, really bringing together data from around the world into one dashboard that has been used the world over. In terms of helping other countries, Johns Hopkins Center for Global Health and so many of our faculty and staff have done public health interventions, medical research, and humanitarian aid the world over well before the pandemic. So that infrastructure exists and offers us opportunities to continue to do that work, but to pivot to pandemic response and help support our colleagues and patients and communities the world over. And in particular, I would call out the Johns Hopkins India Institute, which is so focused on addressing the pandemic and the tragic situation in India, providing education, providing support, organizing the donation and transfer of medical supplies and technical assistance, really standing ready to do whatever is needed to support India right now.
What do you advise people who ask you if it's okay to do international travel?
Up until very recently, I absolutely discouraged international travel. I'm still very cautious about the approach to international travel. Here, I think that the Centers for Disease Control and Prevention has a wonderful website that has a lot of information about how to take precautions when you travel, and also a map of the world that gives real-time data and assessment of the level of risk in different countries of the world. And just recently, within the past week, many of these countries, the risk level was revised. So we are cautiously optimistic to see data indicating improvement in the pandemic conditions in many countries. This is largely due to vaccination campaigns. I think that's a hopeful development, and I would encourage everyone to look at that CDC website before you plan any travel to understand their levels of risk. And the highest level of risk countries, they say to not travel.
Thank you. Do you think that we will need a booster shot in the future, perhaps in the fall?
I'm not sure that it's going to be as early as the fall, but it does seem that the data suggests that we will eventually need a booster shot. And there's two main reasons for this, that it might be recommended. And one is related to the concept of waning immunity and how long our immune reaction and protection lasts after natural infection or vaccination. And so there may come a time based on data that either from laboratory data or from reinfection data that a recommendation for a booster comes out. And then the second reason we might need a booster is because of the variants. And we do see in the lab that some of the variants we have less protection from the vaccines. So thankfully, the vaccines are still working against the variants that have been identified. But in the lab, at least, you can detect that they're less effective. The vaccines are less effective against some of the variants. And so what that tells us is we need to think about a booster that will cover those variants. And we also just need to get everyone vaccinated to stop the virus from further mutations.
And we also need to encourage people to get their annual flu shot. I know that is also a big problem and always has been in trying to inspire someone to get their annual flu shot. But I think that's more important today than it's ever been before. One of the things that I've seen in the media, especially on television, whenever the news is discussing the vaccinations, they keep showing someone receiving the vaccination. And so you just see this needle going in somebody's arm, and there are many, many people who are needle phobic. And I just feel like this is making it worse. That if someone isn't getting the vaccine because they're frightened of needles, and there are lots of adults that certainly are, that this method of showing we're trying to entice someone to get the vaccine is not the right direction. I'd rather them interview someone right after they got the vaccine and say, tell us why you came today and got vaccinated, because I think that will inspire people. They might say, I'm taking care of my 93-year-old mother and she got vaccinated, but I want to make sure that I am too, and anyone visiting her, et cetera. So if you have any influence on the news, tell them to stop showing people's arms and these needles going in it, because it's not truly, I don't think, is very helpful.
Great suggestion, and one we should take very seriously to really understand people's hesitancy. And of course, aversion to needles is a big one for any vaccine. I love your suggestion and certainly worth exploring and acting upon. I agree with you that some of the most compelling testimonials have come from those who have just received the vaccination and talk about what they can now do that they couldn't do before, and that feeling of protection and the altruistic feeling of knowing that they've protected not just themselves, but their family and everyone around them. And to your point about the flu, I know we've all been focused on the pandemic, but we need to not forget about influenza. It kills millions of people each year as the epidemic of influenza sweeps the globe. And we've learned so much during this pandemic response that can be applied to influenza as well. One of them is the importance of vaccination, and then also the effectiveness of basic infection prevention and respiratory etiquette during respiratory virus season. We've seen almost no flu during the pandemic, and we have also not seen respiratory syncytial virus and other respiratory viruses. So wouldn't it be fantastic going forward if we could incorporate mask usage, stay home when we're ill, or work remotely when you have respiratory symptoms? I think that some of the physical distancing, hand washing, masking behaviors during respiratory virus seasons could really save a lot of lives.
I agree. How will COVID-19 help us anticipate and respond to the next coronavirus? Because even though it was 100 years ago when we experienced the last pandemic here in the United States, I don't think we're going to have to wait 100 years for this to happen again, unfortunately.
That is unfortunately likely true. And so many efforts were put into pandemic preparedness before this pandemic. And now we know that that was not enough. It didn't cover all of the areas that needed to be addressed. And so we have a lot of work to do to prepare ourselves for the next pandemic whenever it comes. We have learned lessons. At least there are lessons that we need to learn and incorporate for ourselves, for future generations. What are some of these? It's a long list, but just to highlight a few. We have seen the fragility of the global supply chain and how this can severely hamper or even cripple the pandemic response if you don't have the personal protective equipment, the testing supplies, the reagents to make therapeutics and vaccines, much less all of the other things like hand sanitizer and daily goods throughout the world. Our supply chain must be addressed. One of the things I would highlight that we really need to focus on in pandemic preparedness is bringing other disciplines besides infectious diseases, epidemiology, and emergency management into pandemic preparedness to think about the human response from a psychological, sociological, political science, and public health perspective. Because as we've been discussing today, all of those factors come into play when you are trying to address a worldwide threat like a pandemic, how to counter misinformation, vaccine hesitancy, the kinds of politicization of the public health measures, and how to better address that. I think that's a whole area that we really need to look at. Of course, there's the basic science that has prepared us to be able to develop this vaccine in record time. And I'm sure there's lessons learned there as well. And that will continue, I believe, to advance and accelerate. But some of these other areas and just our basic public health infrastructure in the United States and the world over needs to be greatly strengthened.
Thank you so much for joining me today. You've really provided a wealth of information that is not information that is readily available through social media or the news or anything else that our listeners have access to. I certainly feel hopeful for the future. I also feel thankful that you're one of the people at the helm at Johns Hopkins to get us through this. So thank you.
Thank you so much for having me and for hosting this opportunity to have a discussion about such an important topic.
Thank you for listening to A Woman's Journey podcast. Join me, Kelly Gear-Ripken, your host, Lillie Shockney, and a variety of Johns Hopkins experts on the first Thursday of each month to learn about medical advances in women's health. A Woman's Journey is grateful for the unrestricted educational grants from HRH Foundation that supports our podcast series, Insights That Matter. For more information about A Woman's Journey's virtual programs occurring throughout the year and our monthly webcasts and podcasts, visit our website, hopkinsmedicine.org/awomansjourney. Like us on Facebook and Twitter, and visit our website at hopkinsmedicine.org/awomansjourney. Until next time, stay well.